you just told us that you were certain that Officer Foster's observation period was okay because you signed off on that checklist, right?
Exactly.
And so you're telling us that since you wrote on a piece of paper that it was okay, that Officer Foster's observation period was all right.
I'm extensively published in this area, so I know that that was correct, yes.
Okay. Now, I want to talk a little bit about the machine that you used, the Intoxilizer 8000. Is that right?
Yes.
But first, I just have to ask you, to the full extent of your knowledge, was Miss Dawson examined medically before or after your test?
No.
Okay, now I want to talk about the machine. Machines are flawed, aren't they, Dr. Smith?
Yes.
And the Intoxilizer 8000, the machine that you use, also has some flaws, right?
There are a few, yes.
And one of those is that sometimes you get a number that's too high and that misrepresents the actual amount of alcohol in someone's breath-to-blood alcohol concentration.
That happens occasionally, but it did not happen in this case.
But it does happen.
Occasionally, yes.
And one of those things that makes your machine give a high number is called mouth alcohol, right?
Yes.
And mouth alcohol can be caused by a number of symptoms, right?
Yes.
And those symptoms are burping.
That's not a symptom, but that is a cause of it, yes.
One of the causes. Thank you. Burping, belching, vomiting.
Yes.
Gastrointestinal problems,
Yes.
acid reflux,
That's gastrointestinal problem.
including a symptom of heartburn.
That is acid reflux.
And you are not aware that Miss Dawson had any of those symptoms on the night of, or the morning, I should say, of September 25th, 2009.
That was not.
And, however, if it came to light later in trial that Miss Dawson had some of those symptoms or problems on that night, your numbers would have to be reanalyzed, wouldn't they?
That would have generated a spike in the test, which would have caused an error message to appear.
However, sometimes when you have mouth alcohol, you get a higher number, there is no error message. Isn't that right, Dr. Smith?
That would have been evident in the second breath sample.
However, sometimes you get a higher number and there's no error message.
Not in 2 repeated tests, no.
Dr. Smith, sometimes there's no error message.
Not in 2 repeated tests. There would have been a marked decrease in the second test.
Are you telling this jury that you're 100% positive that in every single test there's not going to be a higher number and there's always going to be an error message?
I'm 100% positive in this test that there was no error message and there was no spike.
Do you remember making an affidavit in this case, Dr. Smith?
Yes, I do.
And would you recognize that
I
affidavit?
will.
May I approach the witness with his affidavit?
You may.
Dr. Smith, could you flip to the last page and tell me if you recognize the signature as your own?
I do.
And when you took this affidavit, you made an oath to swear the truth, the whole truth, and nothing but the truth.
I did.
So you had an opportunity to change this affidavit and include any new information that you might have thought of.
I did.
So if you'll read along with me, with Dr. Smith, as I read aloud from line 103, or 102 to 103, I'm sorry. Mouth alcohol will generally cause a spike in the BRAC curve. Did I read that correctly?
Yes.
Dr. Smith, you've tested hundreds of individuals in this sort of test, isn't that right?
Yes.
And a lot of them are intoxicated.
Yes.
And you know the symptoms of intoxication pretty well.
I'm familiar with them, yes.
But you were surprised by the results of your test, weren't you?
I was surprised, yes.
And you thought that Ms. Dawson would be around the legal limit.
Yes.
Ask the witness.
just a